Saving the heart of a bodybuilder. Hello, everyone. I am John Jewett, owner and lead educator on J3U University. We elevate physique education. And with bodybuilding, we, of course, inherently, and this is with enhanced bodybuilding, have just an increased risk to several different organ systems. And the greatest risk you're going to pose to yourself using PDs in general is going to be to the cardiovascular system. You could very well make an argument as well for the brain being the most important, a longevity factor. But what we see early deaths are from cardiovascular disease. We have bodybuilders in their 20s and 30s that have passed away, and it's very sad to see. And doing this lecture and putting out information like this, I aim to try to reduce the risk. Obviously, the easy answer for those out there, like these morons taking steroids, like just don't even do it and you won't have to worry about it. And obviously that's the obvious choice, right? But we get something out of bodybuilding that is self-development wise, that's letting us see out this greatest purpose of our lives. So it's something that we want to pursue, and you can pursue it. Just realize that you absolutely will be taking risk, and there's likely going to be an aspect to pay for that. However, we shouldn't put the blinders on and go completely risk adverse, and we should try to aim to reduce that risk where we are and just have a harm reduction strategy. So I just came up with an entire heart lecture on J3U, going through several different aspects around cardiovascular disease and bodybuilding and how we could reduce these risks. And it's probably the most important lecture I've ever put onto J3U that I hope more people that compete, that are using PDs, go through. So I feel like it's something that's extremely needed in this space. But why does this happen to begin with with cardio pathology and bodybuilders? And there's a few different components that are going to lead into this pathology when you are taking PDs. And of course, a lot of this is focused around anabolic steroids, as these do present the greatest harm. But we're also using other things that are present too, like stimulants like clenbuterol, growth hormone, other fat loss agents. All these things of this polypharmacy can still contribute as well. But kind of the different tiers around cardiovascular pathology that form with the bodybuilder is for one, thrombosis. So steroids are impacting your red blood cell count, making the blood more viscous. But more of the issue is that it can present abnormal clotting. So you might be more liable to have some type of clotting that occurs, which puts you at risk for a thromboembolism or a pulmonary embolism or stroke. Now, this all makes the heart have to work harder as well to pump this thicker blood through the system. Another component around this is that steroids impact your lipid profile, and dyslipidemia, so just changing of LDL, HDL, triglycerides, apoprotein B, and there's a few things that we look at here, inflammatory factors, all can start creating atherosclerosis, which is this plaque buildup in the arteries and narrowing of vessels, also impairing, for one, blood flow, oxygenated blood flow to cardiac tissue, and also narrowing the passageway of this blood to flow. So now the heart has to pump harder, and is also not getting as oxygenated to perform this action. We're also faced with PDs impacting hypertension. This isn't necessarily directly to the heart. However, the surrounding vessels, it's now going to make that heart also have to pump harder because these vessels are getting more restricted, or there's also more water surrounding the heart and creating pressure on the heart itself. And then finally, this other fourth point around the pathology is androgens roll directly to the cardiac tissue, creating cardiac remodeling. And you might have heard this as part of it is left ventricular hypertrophy. So the increase of the left ventricle, which is your main ventricle that pumps and pushes blood out to the rest of the body, which that's the part that has to pump the hardest. So in turn, these steroids can increase the wall of this left ventricle. And you think like, oh, cool, it just makes a bigger muscle. Well, it also leads to dysfunction of this muscle because androgens also increase oxidative stress, inflammation to this cardiac tissue, can lead to cell death of the cardiac tissue and making it larger but less functional. So we have what is called a decline in ejection fraction. So this is the volume blood that fills up with the heart, and when it pumps, how much actually leaves the heart. And what you see in these steroid users is that ejection fraction declines, and that heart pump leads to not putting out as much blood throughout the body. So we have kind of these four-pronged aspects of what is leading to this cardiac pathology in bodybuilders. And why we want to know how these things happen is so we know what to monitor. And so why this is our first step is having an accurate assessment is to reduce the risk. I think of this, I like car stuff. So I think of this as like when cars came out with electronics and check engine lights. Otherwise, you'd be driving down the road and your car starts smoking. You pull over, you're like, oh no, my motor burned up. I don't know what happened. But now you have an engine light that comes on, be like, change your oil, stupid. You're like, oh damn, let me go change my oil. And then you keep going down the road and you're okay. So when we're having this monitoring system, these are like putting in our check engine lights. So we're going to have ability to test for risk of thrombosis, atherosclerosis, cardiac remodeling, and hypertension. So when we're seeing these changes maybe even start to happen, we can put interventions in place so we don't end up on the side of the road with our motor burn up or having some type of heart failure or cardiovascular event that takes place. Yes, this is about improving health outcomes, but also it's about improving your physique. To be in the bodybuilding game, you need to be in there for 10 to 15 years, and a healthier physique is going to be able to make more progress and run into less roadblocks of having to manage poor lab work or just poor work capacity because your blood pressure is so high, you're gassed during your sets. And also there's life after bodybuilding, right? You want quality of life after bodybuilding. So the first step is assessment in this process. So we're going to look at what I recommend lab work every 10 to 12 weeks for bodybuilders. This is going to be including, and there's a list that I go through in our heart lectures of everything to include, but you're going to want a CBC, a CMP, a lipid profile, and a full hormone panel. Now, there's some additional labs that you want to add on to really make sure you're reducing risks that are really specific to the heart, which for one is a high sensitivity C-reactive protein. This is a marker of inflammation, which low-grade inflammation drives a lot of this pathology that we see in a lot of the disease states. Also homocysteine, which is an intermediate amino acid, but we need this to can increase for DNA and nucleic acid synthesis. And we see it's associated independently with cardiovascular disease and also high blood pressure. So it's another one that we'd want to check within this. A vitamin D level is, we see vitamin D starting to be connected with a lot of different disease states. So checking that. Also, we can add on some other cardiovascular markers that don't typically get added on, like an apoprotein B, which can test the number of atherogenic LDL particles that are being present. And another one that I do include is ferritin. As in bodybuilding, you can get iron excess easily for the type of foods that we consume, and high ferritin levels can also increase oxidative stress to all of these tissues in the body. Now, there's several other labs that we can add on, but I would say like check our heart health module for the full list of what would be included. And then if you find yourself with some issue popping up, like your hematocrit's very high, you have a family history of stroke or some type of thrombosis event, then we could do like some further testing. There's factor V Linden, which is a common genetic defect that increases your risk for blood clotting. There's also the MTHFR gene, which makes you more susceptible to having high homocysteine. This is someone that would need to then supplement with methyl B12 and methylfolate. So what we do is we have our baseline testing every 10 to 12 weeks of these lab markers. If we're seeing areas pop up like, oh, my lipid panel is skewed, we might add on the additional testing to get some further insight for that risk. And then we might even add on the genetic testing for even more insight into those risks. So those are the markers that we want to be checking just in the serum lipids. Now, what else can we be doing to monitor further the cardiovascular system? How about we actually look at the heart itself? And this is through an echocardiogram, which is an ultrasound of the heart. We actually look at the shape of the heart, the size, and also can show valve function and heart function, and can measure your ejection fraction. So it's exactly what we want to know about, where look at, are you having cardiac remodeling occur? And this is something that I would recommend doing every single year to see if the rate of steroid usage that you're currently doing and what you're doing is leading to that remodeling occurring. If so, you should change your approach, or you should also be implementing some strategies when we see that are impactful for cardiac remodeling. Another test that we can be utilizing is also a CT calcium score. This is an x-ray of the chest that can pick up calcification of arteries around the heart, which can be insightful. And now you are having some risk of radiation exposure. I recommend this maybe every 2 to 3 years, having it repeated. But a high calcium score could be indicative of increased risk within the next 10 years of a cardiovascular event, depending on where you score in this rating system. And that would just spur on for, hey, we need to do something about this risk for atherosclerosis that you are presenting with. And then finally, some easy monitoring that we can just do at home and catch things before they become a problem is monitoring your blood pressure once a week. Hypertension is the silent killer for individuals, not just bodybuilders, because you'll have hypertension and you'll feel absolutely fine. When you actually notice your blood pressure is high, you feel flushed, you have, faintness, shortness of breath, you actually would be very high in blood pressure for most individuals. So just checking your blood pressure once a week. If it's high, address it. It's as simple as that. This is a non-negotiable for the guys that I coach. Another one is monitoring resting heart rate. As we see with steroid use, they increase sympathetic drive. They make the heart pump harder. And also all the stimulants and things that we might be taking could also do that. And so we see an increased rising trend in resting heart rate. And resting heart rate's also been associated with cardiovascular outcomes that are not positive. So we're seeing that trend up. It might also spur us on to add interventions present to lower heart rate. So this is just giving some insights into the main test that we should be utilizing for putting these monitoring systems in place. So we have our serum labs, we have our echo, our calcium score test, then also our at-home monitoring. Using these 4 tests, we can get some really good insight into what type of risk we're posing to ourselves and making sure we have a personalized intervention for when these things are coming up. So as you're going through your bodybuilding journey, you'll notice for yourself when you're using certain PDs that you really need to focus your regimen in whatever it may be. Maybe it's your dyslipidemia, so you need a statin in place, or maybe it's high blood pressure and you're the person that needs a blood pressure medication in place. And so it's personalized optimization of health for your bodybuilding journey. Now, this is everything we cover in depth in the heart health lectures in J3U, where you'll fully understand and be able to interpret your lab work in relation to the heart, areas to be able to manage it with your anabolic stack design, and even lifestyle, your body weight, supplementation, pharmaceutical strategies, everything you need to try to reduce that risk. So check out our heart health lecture. It's extremely in depth, and I hope it helps and just improves the industry for what we're trying to do in bodybuilding and just reduces the poor heart outcomes that we do see.